I saw a 14-month-old child once, and her parents had brought her in because she was trying to walk, but every time she took a couple of steps, she would cry and then sit down and then cry a bit more and then try again. And it was a cycle. And then I immediately started thinking about her hip because she must be in pain. So then I did a hip examination, and sure enough, her hip popped out of the socket. That was very diagnostic of developmental dysplasia of the hip, and it is actually more common than you think. Unfortunately, this child had to have surgery, but it doesn't always have to end in surgery. Early detection is the best. So usually when your child is born, your doctor will do a newborn check. And during that check, they're going to check for the hips. Developmental dysplasia of the hip basically means that the ball on top of the thigh bone is not fitting into the socket of the hip, and it is popping out all the time. Sometimes that can cause pain, but most times, in fact, in newborns, it is completely painless. And when your doctor does the newborn check and the hip pops out, they know that this child has developmental dysplasia of the hip. There are some things that can make us suspect it even more. So if a child was born breech, for example, or if there's a family history, then we're a little bit more like, oh, let's double check and triple check everything. If we catch it early, because it's not all cases that are caught early, sometimes when it's mild, it's difficult to tell. If it's caught really early, then we give the child something called a Pavlik's harness, which is basically like a brace, and that stays on for about 3 months, and the success rate is over 90% with that. If the child is under 6 months, usually we diagnose it clinically and with an ultrasound, but if the child is older than 6 months, then we usually need an x-ray to diagnose this. When we do diagnose it in kids that are older, so like for example, if the child is older than 6 months, they will need a cast that stays in again for about 3 months. And again, the success rate is really high. Sometimes the hip exam is normal in the newborn stage, and then as the months go on, the situation becomes more apparent. That's why it's important to keep up with your child's checks. So every time you come in, we will check the hips to make sure it stays in place and we don't hear that clunk that is characteristic. If it is missed, it is a very common cause of chronic pain in adulthood or in adolescence. As the child gets older, there's a lot of pain, and these children are prone to arthritis. So early detection is key in this case. So make sure you attend all your baby's checks.